Good morning, everybody, and welcome to Maryland Business Roundtable for Education's Way to Be at Home series. Today, we are going to do College Tell with Mrs. Bell with some programs from Chesapeake College. I'm Laurie Bell, the program coordinator at Cambridge South Dorchester High School, and I have a special guest today. Today, I have with me Lisa Widmeyer. She is the Director of Non-Credit Healthcare Programs at Chesapeake College. Welcome, Lisa. Good morning.
Good morning, and thank you very much for having me on your show today.
It's a real pleasure. Thank you for being with us. So before we get started into everything about healthcare and what people can possibly do after high school, why don't you go ahead and tell us a little bit about yourself?
Sure, I'd love to. I knew pretty much early on in my life, probably middle school, that I wanted to be a teacher. And I just kind of fostered that throughout high school by tutoring and doing some things, and then decided to attend a small liberal arts college in Pennsylvania and got my elementary education degree. After that, I took a public school job at a small elementary school in Pennsylvania. Then I pretty much jumped right back into education, and I got my master's degree in teaching and curriculum shortly after that.
Mm-hmm.
And taught in the public school system in Pennsylvania for about 6 years before taking a break to raise my children. So I took some time off, and probably about 6 years, 7 years, I took off from teaching, and then decided to go back into public education for a very short period of time. And at that point, I felt like I needed to change. I needed something different. So I took a position at the Eastern Shore Area Health Education Center. So I was still able to utilize my degree in education, but in a totally different way. I was working with students in professional healthcare programs, so physician assistants and nurses, and even medical school students, social workers, physical therapy students. And we talked, my program was more about geriatric education. And then I also took on an additional role as a community health worker trainer. So you can see I've kind of had a varied, history with my work life. And I was there at that, in that role for about 6 years prior to feeling again, I needed a little bit of a change. So I moved on to Chesapeake College as the Director of Non-Credit Healthcare Programs.
Very nice. It sounds like you've had a lot of experience over your life in a lot of different areas, but I have to ask this as a Pennsylvania girl. What part of Pennsylvania were you in?
I grew up in Adams County, Pennsylvania. So the two biggest towns around me were Gettysburg and Harrisburg.
Okay, I'm from the other side of the state. So are you an Eagles fan or Steelers fan?
I'm actually neither.
All right, I wasn't sure if I was opening a debate there, but that's fine.
Yeah.
Okay, so what is it with your job right now that you enjoy doing most?
I like challenges. I like doing something new and different. And at Chesapeake, I'm in a whole different kind of world. I'm in higher education at this point. I still get to interact with students, which I love, and which is, why I went into education, is because I love working with students. But I also get to really be more involved in curriculum development, which I really wasn't involved in public education. So I like that piece. And again, my master's degree is in teaching and curriculum. So I get to utilize that degree a little bit more. And I honestly like the flexibility of being at community college. One good thing to note to our audience is that we have off on Fridays during the summer. So I do enjoy that flexibility. But again, just the challenge is what kind of brought me to this place.
Very nice. So with these challenges and this curriculum that you're involved in, now it's time to get into the meat of the interview. And let's go ahead and talk about what a non-credit healthcare possibility is. What does that mean to our students? What do people do with it once they earn that certificate?
Mm-hmm. Okay.
Can you tell us a little bit about it?
I would love to. So when we think about colleges, we typically think about credits and degree. And on our side, on the non-credit side, we really focus on short-term trainings and education that are really designed to get individuals into the workforce in a very short amount of time. Our programs can last as short as 3 months. So get in, get trained, and get out into the workforce in as little as 3 months. Some of our other programs are a little bit longer, but typically at Chesapeake College, a degree program, you're going to go for a 2-year period. Whereas our programs, if you just want to get in there, get some experience, and get out into the workforce, this is really the way to go.
Very good. What are your most popular programs then? I'm going to assume it's more than one. I'm sure you offer more than one. What would be the most popular that you see students going into?
Okay. Well, let me just tell you kind of what we have on our plate,
Okay.
and then I'll go into the most popular ones.
Sure.
So we do offer our Certified Nursing Assistant program. We say CNA for short. It's actually a dual program, so you get your CNA and you get the option to get your GNA as well. So that stands for Geriatric Nursing Assistant.
Thank you.
So you would get 2 certifications in that program. And that is one of the programs where you can get in and out in about 3 months. Some of our, and that really depends on the course schedule. So we have many CNA courses throughout the year. And some are day programs, some are evening programs, some are even offered on weekends. So we really try to offer that flexibility to our students so you can still work and get trained and get a certification. So that's our CNA GNA program. Another program that we have here is the Clinical Medical Assistant program. And I find that students are not really sure what that means. So if you wouldn't mind, I'd like to just kind of share a little bit about what a clinical medical assistant does.
I would love that.
Okay, good. So a clinical medical assistant works primarily in outpatient settings. So you would see this type of individual in like a doctor's office or in a specialty clinic or an urgent care center. So some of those specialty clinics could be a dermatology office or a surgical center, did I say cardiology office? So some of those specialty offices, and they do kind of what the title says. They do clinical duties. They work directly with the patient. They're taking vital signs. They're doing a patient assessment or history. And they're doing lots more other types of procedures. So they're assisting the provider with procedures, with doing maybe even blood draws. We do teach that in our curriculum, as well as EKG placement. So that's our clinical medical assistant program. We also have our administrative medical assistant program. So that's different. It's not at all clinical based. So you're really not going to be doing hands-on patient care. You're going to do more front office duties. So checking the patient in, taking their payment, processing and documenting in their medical record, those types of things, scheduling patient appointments. If I continue on to our next program, we have our dental assistant program. So I'm sure most of us have been to the dentist office at least one time in our lives. And so a dental assistant is someone who does that, assists the dentist through procedures and whatnot. We also have our veterinary assistant program. And one thing to note about that is, again, it is an assistant. It's not a vet tech. Some people confuse the two. So a vet tech is a 2-year degree program. We do not offer that at Chesapeake, but we do offer the entry-level veterinary assistant program. And then we also have our personal fitness trainer. So if you're really into wellness and the gym and you would like to work with clients one-on-one as a trainer, we do offer that that program as well. As far as our most popular, I would definitely say it's the CNA GNA, and that's because the employability in that particular area is high. We need CNAs and GNAs desperately. We have employers calling us weekly, every day, saying they need CNA and GNAs. So if you really want to get out and kind of get your foot in the healthcare world, CNA GNA is a great place to start. Another one of our very popular programs is the clinical medical assistant program. And I think it appeals to people because you have that clinical component to it where you're working directly with patients. Mm-hmm. And another one of our very popular programs is our dental assistant program.
It sounds like if somebody really didn't want to spend a lot of time in school but wanted to start a career,
yes,
they could take one of these programs.
Very much so. It's perfect to kind of get your feet wet, to find out if you really like the field and if you like the whole idea of, getting additional education.
So let me ask, if somebody were to get one of the certifications, is it possible to build on that with some of the other things?
Absolutely. So in our world, on the non-credit side, we do say that you can get stackable credentials. So that means you can get kind of like your base certificate or license, and then you can stack on top of that. So one particular program where we do stackable credentials is the CNA GNA. So the CNA is basically your first level, and then you can get your GNA, which is your national certification. And once you have your GNA, you could come back to Chesapeake and get your certified medicine aid stackable credential, which allows you to pass meds in a nursing home. It gives you a different level of duty and experience.
Sorry about that. He's got it. Sorry.
So yeah, we do have stackable credentials. And again, like I said, for the veterinary assistant, you could start at Chesapeake with your veterinary assistant. And if you really enjoy it, you could go further. You would have to go to a different institution to get your veterinary tech. But again, it's a stepping stone that you could kind of build upon and use as a pathway or a career ladder.
It sounds like there's a lot of great opportunities if a student chose to go this way. My next question would be for that student to look at themselves and figure out if this would be right for them. What are some traits that students might have in common that go into this type of field?
So this is the healthcare world, so you really do have to have a passion for helping people. And you do have to be very much committed to learning. So I would also say that you have to have strong communication skills and have to be pretty disciplined. Just because these are certificate programs doesn't mean that you're not going to have to put in a lot of work and effort and study time. So we do expect you to be disciplined and to have a good positive attitude towards learning.
I think you have shared a wealth of information. I heard you say that they had the certified nursing assistant. I know down in Dorchester Career and Technology Center, they have a certified nursing assistant. If someone were unable to complete that course, could they jump up at Chesapeake College and finish that out? Or do you ever work with the schools on something like that, a dual enrollment or anything?
So on the non-credit side, we don't necessarily do dual enrollment, but we do actually have a lot of high school students who come to Chesapeake. Maybe they could not get into the CNA program at their high school because I understand it is pretty competitive to get in to those programs they fill. So and also we have students that maybe finish the CNA program at the high school and then life happens and they lose that certification because they don't renew. So we do have students that come back to Chesapeake for a second round of CNA, GNA training. But what's important to note about DCTC is that Ms. Farmer, who's the instructor there at DCTC, she is also one of our adjunct instructors for our CNA program. So she teaches us on the side, and she's a very popular instructor. Students really like her, and we're blessed to have her on staff at Chesapeake as an adjunct.
A wealth of information you're sharing with us today. Before we go, I heard you mention earlier there were good job placement prospects, especially since we really need the CNAs. Do you have any other advice you would give to students at this time? You know, it's a really interesting world we're living in. And is there any advice you would have to offer to them right now?
I would advise students to contact me at cehealthcare@chesapeake.edu. We do have bi-monthly healthcare orientations that really talk about these programs a little bit more in depth. And we also talk about the prerequisites that are required to enter the program. So I would encourage students to reach out to me, to look at our website for various opportunities. But these programs that we offer, again, are a great way to kind of get your feet wet and enter the healthcare world with limited amount of time that you need to invest, as well as we have a lot of funding and scholarship opportunities that help students get these trainings for free. So I would encourage students to contact me, and I would love to share all the information that we have available to students for these different programs, as well as funding opportunities.
And we will make sure we put your contact information in our comments.
Thank you.
Lastly, I just heard you said one more word, prerequisites.
Yes.
Any ones we can know about real quick?
Absolutely. So most of our programs do require a high school diploma or equivalent. Okay. The only one that does not require high school completion is the CNA GNA, but the rest of our programs do require a high school diploma. We also require what's called the AccuPlacer, which is used on the credit side, but we use it on the non-credit side as well. It's an assessment of basic skills, reading and arithmetic. And we require that because we want all of our students to have the basic skills necessary to be successful in our programs. So we do require the AccuPlacer for reading and arithmetic, and that depends on the program as well. Some of our other programs do require some prerequisite classes. Now, these are not required credit classes. These are non-credit prerequisite classes. So if I would give you an example, our clinical medical assistant program requires medical terminology and anatomy and physiology. But again, not the 3-credit anatomy and physiology. So don't let that deter you. This is a 6-week online class, and you can take it for free. And I share that during my orientation. But it's important to note that you need to check to see what the prerequisites are, because our programs do require prior approval. You would not be able to just sign up for the clinical medical assistant program and start the next day. There are some prerequisites required.
Well, Lisa, I want to thank you. You've given us so much information to share with our students, and I know it's so valuable for them to hear it from the people that are actually working in the field.
Well, I love to talk about it, and I could probably be on here for another hour talking about it.
Well, we'll see what we can do about a future meeting. Who knows when?
All right. Sounds great.
So I'd like to thank Lisa again for being with us. Remember to download our Way to Be app for all of you high school students that are looking to see what you might want to do after high school. It will help you figure that out. It's available in your app store. For a Maryland Business Roundtable for Education, I would like to invite you to tune in again on Tuesday, where we have our student ambassadors talking about what life has been like with them during COVID-19 and what their summer plans might be. So for our Way to Be at Home program and College Tell with Mrs. Bell, I'm Laurie Bell. Thank you all for joining us today.